Welcome guys to another video. Today's episode, I'm going to talk about the effects of oral contraceptives and the benefits of oral contraceptives. Right? Everything that has benefits on the father's hand also are the side effects. Right? So I'm going to talk about the side effects of oral contraceptives and the benefits of oral contraceptives, right? Of course, I'm not going to mention everything, but I'm just going to highlight a few, right? So, if you're not subscribed, please remember to subscribe. Just take 1 second, right? Just take 1 second to click on the subscription button and the like button. Just 1 second. Thank you. So, let's learn about let's start with the benefits of oral contraceptives, right? So, the first benefit is it reduces the risk of endometrial cancer, right? So if you use oral contraceptives for a period of greater than, for example, 10 years, right? So it reduces your risk of getting endometrial cancer by about 60%, right? So the first benefit, it reduces the risk of endometrial cancer by at least 60%. That is for after using it for a period of, for example, less than 10 years, right? Yes. Another benefit is it reduces also the risk of ovarian cancer by, let's say, you use it for 5 years, it reduces it by 50%. If you use it for 5 years, then if you use it for 10 years plus, it reduces the risk of ovarian cancer by 80%. Right? Yes. So apart from reducing the risk of ovarian cancer and endometrial cancer, it also reduces the risk of formation of benign ovarian tumors, right? Formation of function ovarian cyst, right? Yes. Apart from those, it also reduces the risk of iron deficiency anemia, right? So if you use oral contraceptives or some form of life, right, it reduces the risk of having iron deficiency anemia, right? So apart from that, some studies also show that it reduces pain during menses, what we call dysmenorrhea, right? So if you use these oral contraceptives, it reduces pain during menses, what we call dysmenorrhea. It also reduces abnormal uterine bleeding, right? So these pills, the oral contraceptives, the combined oral contraceptives or the progestin-only pills, they reduce your risk of having abnormal uterine bleeding. Having mentioned the benefits, right? Let's now go to the side effects, right? They also have the side effects, the negative part of it, right? One is it can cause what we call an ovulation, right? So after using oral contraceptives, so maybe a period of, let's say, maybe 1 year, 2 years, 3 years onwards, you can suffer from an ovulation. Maybe you stop using them, you are planning to have pregnancy. You can fail to have your ovulation, maybe for some months, right? Yes, so it can cause an ovulation. And you know, when ovulation does not take place, the likely outcome is that you are not going to get pregnant, right? No ovulation, no pregnancy, right? So it can increase, it can cause an ovulation, that is lack of ovulation for some months. That is after using it for a long period of time, right? Apart from an ovulation, it can also cause what we call amenorrhea, right? Maybe you are used to getting your periods maybe after 21 days, maybe you are used to getting your periods after maybe 28 days, right? This can change after using these pills, right? You can maybe get your periods after maybe 35 days, right? Or you can even get your periods after 20 days, right? So the duration of the periods, maybe the timing of the periods can change, right? Yes, so it can come after, maybe you are used to after 28 days, it can maybe come after 35 days, or it can not come at all, right? So you can even lack your menses, right? Yes, so that is one of the side effects of oral contraceptive. Lack of menses, delayed menses, early menses, right? Yes, so you should be aware of that. And apart from an ovulation, apart from amenorrhea, it can also increase your chances of having what we call deep vein thrombosis, right? Where you have a blood clot in the vessels, right? So why are we saying this? Because Combined oral contraceptive, for example, contains estrogen and progesterone, right? Estrogen increases the chances of blood clotting, right? So blood clot can be formed in your veins, so that can complicate to what we call the deep vein thrombosis, right? So again, these pills can increase your chances of having deep vein thrombosis, or what we call thromboembolism. You should be aware of that, right? Yes. So apart from these three, it can also increases your chances of having cervical cancer, right? Remember, you're taking estrogen, right? You're taking estrogen. So if you take this combined oral contraceptive for a long period of time, let's say greater than 5 years and above, the chances of having cervical cancer is also very high, right? In comparison to somebody who is not using them, right? So these pills can increase the chances of having cervical cancer. Apart from that, you can have maybe light vaginal bleeding, light or spots, right? So you can have bleeding, right? Continuous bleeding, right? This is a side effect of these pills. You can have light spotting, light bleeding, right? Maybe during the early periods when you're using them, yes, or after a period of time. Apart from that, we have breast tenderness. Again, you're taking estrogen, that is combined oral contraceptives. The chances of having breast tenderness also increases because you are ingesting hormones, right? So there are a lot of changes that can take place maybe in your breast, right? And we have breast tenderness. Apart from that, you have the normal signs, the likes of headache, the likes of nausea, we have the likes of vomiting. Those are normal too. Even all these other drugs. Yes. So before you make a choice of which kind of contraceptive you are going to use, weigh between the risk, the benefit, and the risk, right? Yes. There are others that the benefits outweigh the risk, and also there are others that the risk outweighs the benefits, right? So before that, consult with the physician, right? Consult, do some tests, right? And weigh between the benefits and the risks, so that you can get the right contraceptives. That is the oral contraceptives. Not all of them will favor you, right? There are other people that they don't favor at all. You have a lot of vaginal bleeding. You have maybe you don't see your periods throughout, right? Yes. So not all will favor you, right? You have to consult your physician so that you can get the right contraceptives, right? So the likes of bleeding. You can bleed for maybe you are bleeding in the whole month, you're bleeding for 2 months, you're bleeding for maybe 3 months. It can happen, but not for everybody, right? So whatever has worked for maybe your friend or maybe your sister may not work for you, right? Yes. So you have to weigh between the risk and the benefits, right? Yes. But before then, you have to consult with the physician. Don't just walk into a chemist or a pharmacy or a clinic and just buy this kind of pills, right? Consult and get the ones that may fit you as well as you want, right? Yes. So everything that has benefits has risk, right? Yes. So those are the risks and those are the benefits of oral contraceptives. I've just mentioned but a few. Yes. That's my end of our video for today. If you're not subscribed, just take 1 second to subscribe, right? Just 1 second, right? Yes. More is coming, right? So continue commenting, continue liking, right? Let's interact in the comment section, right? Yes. So let's see each other in the next video.